Welcome to Ask Syd, the official podcast for Sydenham Clinic. Today I come to you from our flagship location here in Beverly Hills. I am so thrilled to bring different guests onto the podcast so that we can talk more about our 7 pillars of health, and we can go deeper into your genomics, your gut health, your hormones, your sleep, your nutrition, psychology and physiology. So let's bring it on. Welcome back to Ask Syd, and as you can see, there's a whole new setting, and I'm here with Dr. Lugo, Dr. Raphael Lugo, our medical director at the Woodlands Clinic.
Thank you.
Welcome.
Thank you.
We're so excited. This is our new baby. This is our 3rd location here in Texas. We have 2 clinics. We have one in Beverly Hills, and you're leading this. Thank you so much for your leadership, and I would love for everybody to get to know you a little better through the podcast today. We're going to dive deep into all things biohacking, and we'll do a deeper dive into sugar. Well, without any further ado, let's start. Dr. Lugo.
Yes.
You're a surgeon, 3 decades of being a surgeon, and now you're like one of the most prominent personalized biohacking functional medicine physicians here in Texas.
Well,
how did that happen?
Not by accident, but kind of a design. You're right, 30 years doing surgery. And the last decade, I got an interest because as I got older, I started facing my own mortality. And that made me wonder, hey, am I getting everything I need? There's so much noise out there. And I said, when I look at my patients over the years, I always treated my patient. If you go to my website, you can see that where I say I treat the patient as a whole. And that was true. I always sit down, I always had the interest in knowing their A1C because I understood that the healthier the patient, the better the outcomes. That's the secret to my success. People say, how do patients do well? Well, I pick my patients, I optimize them, and I make sure that when they go to surgery, they're the best they can be. And that took some work, and some of it was with my partners, primary doctors in the area, and I started slowly taking that on myself, helping the patients and realizing that our doctors are trying the best they can, but the truth is they're overwhelmed with the amount of patients they see. So here we come to the rescue to help those patients that need the extra help. That paired with the fact that, I'm human and I start seeing my own problems, high cholesterol, high blood pressure, and the current medical care was not doing it because we were more reactive. Blood pressure's high, here's the medication. Lifestyle was told to do, but there were not real tools to take care of it. So I started looking at the different tools outside the box. And in my case, they paid off. I reversed blood pressure. I lost the weight. I improved all my markers. And I started realizing I better learn this. So the last decade I dedicated to learn more and more. That's the good thing, the beauty of medicine. We can go back and learn anything you want. You have the license. And that comes with the duty. So I wanted to learn what are the actual evidence-based tools that are out there that I'm not going to harm my patient and is going to maximize their output. And that's, in essence, what happened.
Fair to say that even for getting better surgical outcomes, biohacking or optimizing your body leads to better outcomes even through surgical procedures?
Absolutely. In fact, some of the major hospitals in the area, are starting to do that themselves. They have now programs where they look at the patient and say, hey, before you do the hernia surgery, let's put them through this program where we optimize their entire health. The truth is, they have good intentions, but they're not necessarily geared towards that. And that's where people like us come to play, where we can really help that happen. And everybody benefits from that because sometimes hospitals are paid by outcomes, so they want to have the best patients, and we need to help that. So absolutely, that is that's the most important thing that somebody can do before surgery. You optimize your entire health. If you do that, your outcome is going to be way better. That's for sure.
And this is the missing piece in modern healthcare, and I truly hope we can make that difference through role modeling the right model of care. I think that's what, we take our role here at Sydenham very seriously because we're trying to pave the way to really role model the right method of care. It's true health care. It's not sick care. It's not reactive care. And I guess like that was your experience, doing fix-it surgeries and not really having that exact kind of an impact that you probably wanted.
Correct. And that's what impressed me about this clinic. That's why I said I want to partner with this clinic. Because when I look at your model and I studied, I didn't know Dr. Sinham. I didn't understand where the name came from. But he was a pioneer in the 17th century. That man already knew personalized care was the important part. And you coined that and you created this clinic. And I saw your 7 pillars and I said, this aligns very much with what I'm doing. I love this and it makes a lot of sense. Why reinvent the wheel? You already have a system. I have the knowledge and I have the desire and the passion for this kind of thing. So I think it's a great mix.
I think we're really set up for success. And the Woodlands community here was, I think, hungry. Like they were hungry, they were thirsty for something like this. And I'm so happy that we're able to bring personalized preventive care to the Woodlands community. You talked about the 7 pillars. Let's dive deep a little bit into the 7 pillars. Why you feel they are important, and from a biohacking point of view, why do you think these 7 pillars really are something we should look at holistically?
Well, you start with to me, the number one, the genetic part, to just understand what you're made of, to understand exactly what's particularly specific to you, the patient. Because when you are looking at healthcare, if you don't start with that, which is not a perfect science yet, but it's getting better and better. We have tools that Dr. Sinham didn't have then, so now we have these tools that we can really exploit and understand what are the deficient parts, what are the parts we got to pay attention. So that to me is very important. And
our genes are not our destiny, so you don't look at just your genetic reports in isolation, right?
Correct. And that's not the purpose of that, because you're alive for a reason. And the reason is your genetic makeup may have some deficiencies, but it made up for each other. It just compensates. So our job is going to be look at those things as a guide so we can optimize and try to prevent those bad genes from expressing as we get older through epigenetics, through different optimization of your lifestyle, supplementation if you need it. There's different things that everybody's different. The cookie cutter is not going to work long term. We have to specialize. And this is why I think when you put these things together, it makes it personalized and very important and very efficient, very effective.
It's a good baseline blueprint.
Correct. And you address every single component of the human body and the different, the human body is very complex.
Right.
You can isolate one thing. You can say, we're going to fix this and everything else falls into place. You have to really pay attention. I always compare it to an airplane. Airplanes have multiple different gauges. Imagine the pilot flying a plane and not looking at any of that. Forget the oil, forget the other things. You have to look at every one of those little meters, and then that way you make the flight. Exactly how is the body. If we're not paying attention or have somebody helps you figure out what's going on, you're not going to fly too far.
We don't have an autopilot mode in our body though.
Correct. I wish we did.
I wish we did. Maybe someday.
Yes.
Okay, so the second pillar, which is very important, gut health.
Yes. Well, the more we learn about gut, the more we understand we really have to understand what's inside of us. We have so many bacteria, and they're our friends. They're living there and keeping us healthy. We sometimes treat them poorly with the food we feed it, with the antibiotics we take, with the medication, sometimes the supplements. So the more we learn, we realize if we fix the gut microbiome and we make it work efficiently, mental health, cardiovascular health. And we're in the infancy of this. We're learning. But at Sydenham Clinic, we're just staying up front. That's the key. You just stay in the forefront of the learning, because if you go by traditional medicine, by the time it makes it to the books, it's too late.
15 to 17 years too late.
Correct. So it doesn't mean dangerously go in the forefront, but very carefully and scientifically you decide these are the things that are working, these are the things that do not harm the patient and will for sure help you. And that's what I think is so important. The gut, I like that you put it there, because those two things in the beginning are very much in the forefront of the future of medicine. Yes.
The third one, sleep.
Sleep. Oh my God. People do not sleep. And I'm glad our country finally is starting to look at the importance of sleep. So for years, you hear people, I don't sleep, I work all the time, work. That's important, but if you don't sleep, your body starts deteriorating. And the problem is it does not happen very obvious. You know how I learned that? I'm a surgeon, so we work like crazy. We don't look at that. In fact, they reward you for working
It's glorified.
hard. Glorified. Don't sleep. Oh my God, Dr. Lugo was there 3 days in a row. And we feel okay. We feel like we're doing the job well. We do it well. But our body is screaming. You know when I learned that? When I put the Aura ring, which I love that
all our members
your
get
patients get it.
Yeah.
This is one of the best things to measure and understand your body. You pay attention to that, and you realize how much you're hurting your body. That's when I saw, 7 years ago, I put the first Aura. This is 4th generation. And I remember when I put it on, I start seeing my sleep. I said, but I don't feel tired. But then when you measure and it gives you the information, then you pay attention and you realize, I am tired. I am not functioning at my best. Once I fix my sleep, I realize, wow, what a difference it makes. Everything starts getting into place. You get bloated when you eat, that starts going away. You feel more tired when you go to the gym or sore 4 days, that goes away. So a lot of things start to improve. You need less medication for the blood pressure control. You're in a better mood. You're more productive. So sleep is another very important pillar of everyone's health.
So we optimize your genomic epigenetics. We optimize your gut. We try and optimize your sleep. And like you said, measurement is key.
Yes.
So we generate a lot of data on all our members. We do a lot of testing.
Yes.
The beauty about Sydnam is that you are empowered to do whatever test you want for early detection, prevention, and your hands are not tied by the insurance system.
And that's the key. So people tell me, why does insurance doesn't cover this and that? Well, insurance companies are not geared to help your health. They're geared to make money. And the problem with that is, they cover evidence-based stuff, but it's old. They're not preventing, which I'm surprised because they will make more money if people stay healthy, but it's not geared towards that. And they're not going to cover what's best for you. So we have to take responsibility. I always tell people, when you have your car and you have a problem with your windshield is broken, or that's when you go to the health insurance. But when you have to prevent, you got to change the oil, you got to put gas. Do they cover that? No. And that's the same thing with health insurance. I think you cannot rely on them to cover your personal needs. Unfortunately, you have to take advantage of that. And I always tell my patients, if you do it now, you prevent a lot worse outcomes down the road that will cost you a lot more, not only financially, but also personally.
Your health span. It's the
span.
quality of life in those last 30 years.
Correct. It's sad to see how people in our country work all their life, and the last 20 years, what they're doing, treating chronic illness.
And you have the financial freedom at that point. Very often you have the money, but you don't have the health.
Yes, and that's sad. So, yes, it's very important to be able to do that. Don't rely on your insurance. Your insurance is there when you get sick. Chronic illness, a major event, you need cancer surgery. Hopefully we'll prevent that or delay it. And most people think, well, I'm going to die of something. Mm-hmm. But the question is how soon you want that to happen. So let's delay it. Let's prolong it. Let's not just be sick at the end of our life.
Let's hit it at 120, but 120 would feel like 70.
Correct.
Let's go to the fourth pillar, nutrition. And I know you're big on this, and you work very closely with Heather, and both of you have this amazing partnership where she's a clinical nutritionist and you're the physician. And
that's one thing.
Nutrition.
That's one thing I am so happy that you guys have a nutritionist, because in my practice it was one of the things that's the hardest thing to find. Heather impressed me tremendously. Her knowledge on biochemistry, on genetics, and then on nutrition. Why? Because you have to put it together. You can't go one thing only. When you look at the RDAs and if you're going to follow that, then you're going to go crazy, because that pyramid has changed in my life so many times. So you have to personalize it.
That's the key.
Yes.
That is the key in nutrition.
Yeah, nutrition has to be extremely personalized. That's one of the most personal things, because the way we're eating as a country is not healthy. And the way people try to eat based on somebody else's habits is not a good idea. That's why I'm a little bit against these coined diets that people put out there. Oh, this diet, that diet. That may help a small number of people. And the problem is when people just start doing this diet, they may get positive results for the time being, but you don't know the other effects that it's causing in the rest of your body. And that's very different from one person to the other. I've seen people in the keto diet that are doing great, and there's tremendous knowledge and people that definitely benefit for that. But then other people do it, and everything goes crazy. The latest studies I saw, some people were on it, and they were having heart problems from being on the keto diet too long because too much fat. And some people were benefited tremendously the other way around. So personalized diet. So I love that you have a nutritionist in the clinic, because now we have somebody I can partner with, and I can say, hey, this is the patient, this is what they have, and Heather, fix them. That's what I will tell her. Just go fix them.
Love it. Next pillar of health, hormones.
Hormones. So hormones, I think not only they're important, but it's important that you know when to use them. I believe there's an overutilization. All these low-T clinics popping everywhere. When I look at people my age, and I look in the gym and I see so many men in testosterone, and I don't understand, because they look sometimes obese, sometimes they have diabetes, they haven't fixed the baseline. So hormone is one of the components that I think if you fix the other things, it tends to fix itself. But you have to monitor them. You have to understand them. Not only testosterone, but thyroid hormone. Woman perimenopause. Oh my Lord, it has been misled for so many years. Women with all these woman initiative studies that were, wrong, saying that hormones cause cancer, and many women suffered through osteoporosis. So hormones are one of the components that, as we age, we have to pay attention as we fix the other things, because it's part of your body. Like I said earlier, it's not one thing. It's so many things. And hormones is one of the biggest misunderstandings. I mean, I see it all the time. I see people in my office come in, and the doctor has been mismanaging it because they didn't get the right training. So, yeah, hormones are very important, and I'm glad that it's, of course, one of the pillars of a human.
You're so right. I mean, my mother's generation, my grandmother's generation, it was a disservice done to that generation because of the way the studies were interpreted. Yes. And I'm so happy to see that you value this pillar of health.
Yes.
You mentioned you go to the gym, so let's get into our next pillar, which is physiology.
Yes, and physiology is a big broad, and that's what I like about it, because there I put the cardiovascular, cardiorespiratory, everything else, and movement, exercise, and that's one of the things that, I saw the latest study. Actually, last week I was reading 30% of Americans are working out. 30%. And, why do we work out? Because we live a sedentary life otherwise. We're in our phones. We're sitting in a desk. We're driving, commuting. You have to move. And in the last few years, exercise has been in the form of weightlifting. That was ignored mainly by females. Females mainly don't want to work out. I don't want to build muscle. You won't build muscle. You will build muscle, but not like a man. That would take a lot of help. So we find that as you maintain muscle mass, you maintain skeletal density. Mm-hmm. The bone gets stronger. And as you get older, you prevent falling. And if you fall, you won't break that hip. The statistics on a broken hip on an old person, 70 years old, and others, 40% don't make it out of the hospital. That is horrible. So,
and that's preventable.
Yes, preventable, and you stay functional. You want to be able to play with your grandchildren. You want to be able to get in the floor and stand up. So how you do that? You exercise, mobility, yoga, lifting, cardiovascular, improve your VO2 max. VO2 max is one of the most important markers that we can see. If you have a high VO2, your longevity is almost guaranteed, unless you get something tragic. But VO2 max and muscle mass, two things that you need to maintain as a patient. And I'm glad that was one of the pillars. So, I just love how the whole thing falls into one place, and that we're paying attention to it here.
We should, and like you said, it's all these together. It's not one or the other in isolation. And last but not the least, the importance of mental health and psychology as a pillar.
Which has been one of the weakness of our country again. We see it every day, mental illness. there's a lack of providers for mental illness. There's a lack of enough support in our system. If you go to a hospital, there's no psychiatrist there. And I see it in my office. I've seen it, in the last 30 years. I've seen how the patients change, and I perceive more and more mental illness. And it comes from the stressful life we live, from the distractions. There's so many causes, but I think as individuals and as providers, we have the responsibility to take care of ourselves and take care of our patients and pay attention to that part. Because sometimes that is the driver of everything else.
Yes.
It's unbelievable how you see somebody that has depression and everything falls apart. You fix that part and all of a sudden everything starts falling into place. So mental illness is rampant, and we need to attack it head on and preventive. Because, when I look at these people that lose control of their life and they go crazy and postal and whatever they do, there were some signs early on nobody paid attention.
You're so right.
And nobody really stopped that because we're so busy. But that person was suffering or in some type of distress that was not perceived. So we have the opportunity here to address that and help people, hey, let's turn this around. And that's another very important pillar.
And you said we have the opportunity at Sydenham, and I think that's what is so unique, is that you have the luxury of time.
Yes.
You have that physician-patient relationship, that good old physician-patient relationship like how you had back in the day with the neighborhood village doctor. I think in some ways, Sydenham is trying to recreate that.
Yes, and that's what appealed to me, because that's what I've done in my practice. Yeah. People tell me, how is it that you have time to talk to me about my A1C? Because I don't drive myself by the numbers.
Yeah.
It's the quality.
Yeah.
And I love that about this. It's very important to establish that relation with your doctor.
Yeah.
It's a partnership.
Yeah.
Because that person
Yeah.
is going to help you get better. Yeah. And that's very important.
So when people see the clinics, and our clinics look so beautiful, so inviting, so homely, we feel more like a members club or a Soho house. We don't look very medical and intimidating. We don't have like red light saunas or full body MRI, anything on site. Yeah. For that reason, because we want the place to be inviting. We want it to be conducive to forming that relationship between the physician and patient. And the other thing I think, which is very important, what we do for psychology as a pillar, is a sense of community. I think loneliness is a big epidemic. So we do these gatherings called the longevity happy hours, where our physicians talk and go deep dive. And I think we have one coming up here at the Woodlands. We're really excited for you to talk to the Woodlands community. And one of the topics that you are going to be diving deep into one of our longevity happy hours is our next topic, which is sugar. Some people say it's even more addictive than cocaine, and we're giving it to our children in their lunch boxes. So let's shift our focus to sugar.
Sure. Sugar is a topic that, I hear about it every day. And it's hidden in almost everything you eat, because that's what makes it palatable. So sugar in nature occurs in the form of sucrose. And sucrose is what we know as table sugar. So man, we're ingenious, figure out to do it in the lab. And they tweaked it to make it very palatable. And that's where you come with the fructose. They put a little more fructose than nature does. And it doesn't have the fiber, doesn't have the antioxidants. So it's meant to make you a little addicted to it. And that's because that's why you want to eat the next popsicle and the other one and the other one. And it's all hidden in there. And, over the years, people have tried to say, oh, well, I'm going to just replace it with honey. I'm going to replace it with maple syrup. Yes, those are natural sugars, but they still spike your sugar. So sugar has been found to be extremely inflammatory. Not only it burns out your pancreas over the years, because your pancreas is constantly trying to do something with it, but your body also evolved to save calories. We have evolved to be able to preserve our life. So in the past, we used to go 3 or 4 days without eating. So our bodies have evolved to take and pile up calories. How do they do that? Fat. So when you eat excess sugar, several things happen. Number one, your pancreas is working overtime, and it burns out. That's where insulin resistance comes. Number two, your liver is trying to pack and save it, and it can only save so much as glycogen. And once it's topped off with that, then it goes into putting fat in there. That's with the fatty liver. By the way, fatty liver is the number one cause of cirrhosis now, is surpassing alcohol. And where it comes from, our diets. Sugar is the culprit. I don't have many macronutrients, many things that I can say they're bad for you, and sugar is bad. And over the years we have tried we love sweet stuff, so let's just make some things that are substitutes. And we have created substitutes, and most of them are okay, and some of them have been demonized. So I always tell my patients, you pick your substitute depending on your goal. There's going to be different goals. Do you want to decrease your calories? Do you want to avoid diabetes? Do you want both? And they're made specifically for that. And some of them have very good properties. So we can...
Yes, I would love for you to really... Because a lot of people feel they're having sugar sweeteners, and that's fine. But you said there's a lot of difference. Like, there are different categories of sugar substitutes based on the outcome you want. Yeah. Could you help explain what the different substitutes are, and should we be biohacking sugar substitutes, or should we be doing it under supervision, work with a nutritionist, work with a physician? Should we be switching them out?
Okay. I'm going to give you the short version of what to do. So you have alcohol sugars. That's erythritol and xylitol. Those two, erythritol was in the news recently. They said it caused heart disease. Well, not true. It was animal studies, high doses. Animals sometimes metabolize things differently. Not in humans. You can use it safely. It's used a lot. It doesn't have calories. It doesn't spike your sugar. If you eat too much of it, you get diarrhea, because it's one of the things we use sometimes to make some of the alcohol sugars, we use them to have people move their bowels because they're not absorbed. Mm-hmm. They pass from the small intestine to large intestine, draws water, and then you go to the bathroom. So they may make you bloated, and that's the thing. But if you want a low calorie, no spike sugar, erythritol and these sugars are good. Now, it's hard to find that over the counter, so then you move to the next level. You have the sucralose. It's the most common, rampant. It's really not a sugar. It doesn't do anything in your body. It doesn't have calories. It barely gets absorbed, and it doesn't spike your sugar. So that one is good for calorie watch, for sugar watch. There's one little thing that makes me stay on the fence with sucralose, is that there were some studies that show if you give it to a human before a high carbohydrate diet, or let's say typical, I'm going to get the Diet Coke and I'm going to eat some French fries. Bad idea. Why? Because they found it just promotes some of the absorption of glucose. So they found in people that they give the sucralose and then followed by a carbohydrate diet or sugar, whatever it is, could be carbohydrate like potatoes, the sugar went up real fast, and it promotes more absorption of that glucose.
Wow.
So you have to be careful. I mean, that people do the Diet Coke and they eat the French fries or the burger with the bun. It's, and again, it's not a super strong study, but there's a signal that shows that, and I think it's been studied more, and we'll have a definite answer over the time. But for now, if you're doing it for calories and for not spiking your sugar, try to avoid eating that bread right after or the French fries with it, because you're not doing yourself a favor. Now we move to the other one, stevia, allulose, monk fruit. Those are my favorite. Why is that? These are natural sugars in plants, figs, monk fruit, and they have good properties. For example, let's talk about allulose. My favorite is allulose. I'm very biased for allulose. It's very hard to find in products because it's expensive, but you can buy it. It's the only thing, if you're going to make cookies, you can use allulose, and it's going to be a one-to-one with sugar, and it does not affect the taste. The other advantage is allulose is the contrary to sucralose. There's more and more studies showing when you ingest allulose, you promote GLP-1, not like a medication, right, but it's secreted in your intestine. That's where GLP-1 is, and it prevents the absorption of sugar. So they have done studies where the person is allulose and they give them sugar and they do not absorb a high percentage of that sugar. It does not spike your sugar. In fact, there's companies that are doing now products that are, I don't want to promote somebody, but yes, RX, the company that's Sugar RX, I think it is, they are all the products with allulose, and that's exactly what they're making their money on and promoting it, because it does help decrease.
Are they natural sources?
Yes, natural sources. Allulose is taken from figs, usually. Now, is it processed? Yes, because you have to extract it from the plant. Now you can move to stevia. Stevia is a leaf, and you can get it raw. And again, that's extracted from a leaf, and it has some of those properties too. Not as strong as the allulose, but it does some of that to block some of the glucose transporters and does not let you absorb too much of the glucose. So stevia is a good one. And the other thing that they found that some people, they have high blood pressure and they do stevia, it lowers your blood pressure. So
interesting.
It's not a substitute for medicine,
right.
but if you have high blood pressure and you have to choose stevia. And then monk fruit. Monk fruit is the one that is least known, has tremendous antioxidant properties. You can Google it and find more information about the chemical structure and all the different chemical compounds that they has. Very good for you. Another one you can use. So there's alternatives. You don't have to eat a boring life without any sweetness in your life. You can always use these things, and don't be afraid to do it because it's not going to hurt you. It's a lot of everything that's good out there is going to have somebody that's going to say the contrary. So you just have to be smart, talk to your doctors. That's why we're here. Ask us, and we can tell you.
Yeah, your doctor is going to help you pick your poison.
Yes.
Right? What type of sugar? Sugar's
Yes.
not all bad, but it's how you take it, when you take it, what form of sugar substitute you take it. There is a lot of biohacking involved in sugar, it seems.
And one more thing about that, because I don't want you to be afraid of eating sugar, in moderation. Now, one more question I hear, is it better to eat maple syrup or agave syrup? Well, the tequila industry has done a good job promoting agave. Well, agave is natural. Those are, and honey, they're filtered. They're not super processed. Especially if it's organic and unfiltered, you have a good product. Okay, still gonna spike your sugar if you're diabetic. So again, you have to watch what is important for you as a patient. And if you are insulin sensitive, then you can do a little bit more. If you're insulin resistant, you have to be careful. If you're diabetic, absolutely be careful. But the advantage of those versus table sugar is that they have natural products, antioxidants. Some of them have fiber. Some of them have things that will help in other parts of your body, and they're more beneficial than the table sugar. And be careful with cane sugar because it's just table sugar.
Yeah.
The only way to eat the pure sugar from a cane is to bite on the cane. If
Right.
you have it in a bottle, that was processed, and that's probably sucrose. It's just table sugar, just glorified.
And you chew on the sugar cane to extract the juice
Exactly.
versus put it in a machine.
And that's different. And put it in a machine, they crystallize it, they heat it, and that's not sugar, that's not cane sugar. And again, the cane sugar will spike you.
So before we wrap up our section on sugar, could you talk a little bit about fruits?
Okay, so fruits, the advantage of fruits is this. Let me go back a little bit because we hear fructose, that comes from fruits. Yep, fruits have fructose. Fructose made in the lab, high fructose corn syrup, is way different than the fructose you have in the plants. I mean, not structurally, but the way the body does. Nature knows what it's doing, okay? So when you eat fruit, you have a lot of fiber and you have antioxidants. Nature packaged that so well for us to eat it. It helps your body. Again, if you're diabetic or insulin resistant, you have to be careful how much fruit you eat. But fructose, the bad rep comes from the processed foods that they added. And the reason is fructose is not metabolized like sugar. If I take sugar right now, my muscles, every cell in your body can process it and takes it. Fructose, there's only one way to process it, the liver. Goes to the liver doesn't know what to do, it breaks it down and it starts to store it as fat. That's one of the biggest drivers of fatty liver, is the high fructose corn syrup. That's why it's been eliminated in so many foods. That's why there's a big campaign to try to stop it. I agree, we don't need to put that there. Why was it used? It's cheap and it's super sweet. So they use a little bit and it goes a long way. But then if you abuse it now, if you go occasionally and get your McDonald's food or whatever food that has some of that, you're not gonna die. It's continue to use it. And it doesn't satisfy us. So back to the question about fruits, please eat more fruits. Berries, and there's fruits that have more sugar than others. Bananas have a lot of sugar. Berries are one of the healthiest fruits you can eat. Kiwi, amazing fruit to eat. I mean, Do your research and find your favorites and just put them in your plate. Add them. If you need a dessert, do that instead of the sugar or the ice cream. Sometimes do the ice cream too, but don't make it a habit.
Under supervision.
Yes, that's right.
Okay, now to the most exciting part of our podcast, which is our hot or not section. And I'd love some controversial answers from you. So the first one, what's your verdict on hydrogen water? Hot or not?
Not hot.
Why?
Not at all. It doesn't work. It's a gimmick. Honestly, there's some people out there making money on it. Think about it. It's a gas. You open it, you infuse it. First of all, to make hydrogen water, you need to have specialized equipment that will require an amount of energy to put that there, and then the moment you open it, it goes away. Those tablets that they say you put in the water and makes it into hydrogen water, no. So save your money. There's better things you can do with your money.
Okay, the next is very controversial. What's the verdict on Gary Brecka? Hot or not?
Absolutely not hot. Entertainment, but not hot. He's a good marketer, but I hate to be so strong about it, but grifting comes to my mind when I hear that. It's all geared towards making money. And he uses some terminology that's scientific, but he's not a doctor. He's not somebody who underwent the appropriate training to do the things he's doing. Yeah. Actually, if I were to do the things he does, because I have a license, with a license comes some ethics that you have to follow and certain rules, I would be losing my license. And I don't understand why this is not more control. Yeah. Because he says things that sometimes are true. He made a lot of money on the MTHFR. We've known about that for years. The truth is that most people don't need any help. But he made it very, very big, and he has celebrities following him. He has a lot of money behind him. So I'll tell my patients, be very careful. Run by me anything that you see that you think is good, because that's the confusing part. There are things that are true, and there are things that, so it's in the middle. It's a pure marketing, amazing, genius marketing machine. But other than that, be very careful.
On one side, it's pretty cool how young kids are getting inspired and getting into longevity and biohacking, but their source of information is TikTok or social media. Very rarely do you find the younger generation sitting with their primary care doctor, having a conversation about their hormones or whatever peptide they want to consume. It's so important to do it under supervision and the guidance of a licensed physician.
And that I take some of that fault. The doctors have been too busy over the years treating chronic illness and just focus on that part. We've done very well. If you look at the longevity in our country, it's improved. The lifespan has improved from 40, 50 years old to 80, 90, but it's because we're keeping people longer alive. We're not preventing. Mm-hmm. Now, it's unfortunate that the doctors did not spend the time to get the attention of the young people, and they're getting it there. So this has been an area that was basically kidnapped from doctors. And we need to recapture that, because I agree, it needs to be changed, the way we practice medicine, and we need to do it right. So we give the right advice to people.
Absolutely. Okay, cold plunge, hot or not?
Not so hot, pretty cold actually.
Oh yes, very cold, freezing cold.
So cold plunge goes into that new move to try to be, use stress to improve your lifestyle, to improve your health. That goes along with sauna and all these things. Now, cold plunge, I have a little bit of I'm on the fence. You have to be careful when you practice and how you practice it. It has not been as clear cut as sauna. Sauna has been very strong. There's a ton of data that says sauna is great for cardiovascular and many other things because of the heat, proteins, the heat shock proteins. Now, cold plunge, if you have heart disease, and even if you don't know if you have it, you have to be very careful. Think about what's happening. When you let me tell you the physiology. You jump in the cold water, and you just constrict every vessel in your body, including your heart coronary arteries. Everything goes into contraction, and then when you walk out, everything dilates. What the part-a industry is not telling you, and you can research this, there's a lot of studies that show there's a lot of detrimental causes, heart attacks, strokes, that people have, completely normal person, walking around with a block in their heart. They have a 50, 60, 70% block of their artery. They don't have symptoms. They work out, they jump in the cold plunge for the first time, and they have a heart attack. So what do you just do? So I always tell people with caution. The benefits are not 100% there, not very strong studies that I've seen. The benefits are in athletes. After they do a very intense workout, they cool the part that they were working, your basketball player legs, and they improve their performance if they have a short time before they recover. It helps in recovery, but it's a very isolated area, the studies that they've done that benefit it. Jumping in a cold water pool wakes you up, and it's because your adrenaline jumps up. There's no mystery on that. It's because you're in a fight or flight for a moment there, and that's what wakes you up. But the same way it went up, cortisol goes up. So I'm in the fence on that. I am not 100%, positive about it. If you feel good and you want to do it, sometimes all you need is a cool shower. That's something. 1 or 2 minutes of that, it tends to do similar effects. Yeah. It wakes you, makes you sharper. Yeah. So that's why I am not so hard on that.
Well, thank you for sharing that, because like all things Sydenham, even cold plunges need to be done under supervision. Yeah. After we've done all your preventive testing, yes. After you know who they are they women, what phase of their menopause journey are they in? There's so many different factors, and somewhere cold plunges, there's bravado around, oh my God, I can do 5 minutes, I can do 3 minutes. Mm-hmm. And somewhere we don't need to make it so heroic to be able to plunge in cold water.
Correct, yes. So, like everything, check with your doctor, mm-hmm. Make sure you're healthy, then you do whatever you want.
Okay, so the next one, I think I know your verdict on this one, but GLP-1s, are they hot or not?
Ooh, super hot. Super hot. And I'm not being a surgeon, I'm not a medicine happy doctor, but I gotta tell you, we're gonna find more and more on these things, the benefits. I think metabolism is one of the core things in your body. When you fix your metabolism, a lot of things get better. Inflammation goes down. And these drugs are marvelous. I mean, I see the markers in my patients. We put them on these drugs. They come in here to lose weight. They have high cholesterol, they have hypertension, and 6 months, 8 months down the road, we're stopping their blood pressure medication. They were in 2, they're in 1. Their cholesterol is much more level. Their sleep improves. I don't have studies to back every claim. This is observational.
Right.
But there's studies coming out, cardiovascular, kidney function. So stay tuned, because I think they found a gold mine. Obviously, mm-hmm. They did, Lily, and they keep improving them. And I think as more time goes by, more studies come out, and we're going to see a lot of benefits. Doesn't mean you have to run and take it. Again, you have to do the appropriate testing. You find out you're a candidate. And, microdosing is not a label, something that they promote, but you can do some microdosing. I think everybody's different. Again, it goes down to the same thing. We test you, we find out, we can help you, we see what it does. Yeah. And I think it's going to be unbelievable, the future.
GLP-1 protocols have to be personalized.
Has to be there, yes, correct. And we're developing this as time goes by. And I think, that's the closest thing I've seen to a longevity medication. That's one of the closest ones, other than some of the cholesterol newer medications. But that one there, it's a winner.
So the last one. NAD plus infusions, hot or not?
All right, NAD. So NAD, I'm mesmerized, because NAD, I learned about it probably a decade ago.
Wow.
And I remember I saw it, and then True Niagen came in, the company, and it was going back and forth, and I started taking it probably 7 years ago, on and off, because I saw some studies, and some of them said, watch out. Well, this is the truth. If you're healthy, and young, you probably don't need it. If you are aging, 40 or older, you start losing some of that NAD in the cells. That is true. Now, that's not the cause of aging. We can't say it's causal. Mm-hmm. But it definitely helps to supplement some of it, like vitamin D and other things we do. You can increase your NAD by exercising, a good night's sleep, by coffee. All these things increase NAD. Now, if you want to keep levels stable, the other benefit that they have found is it aids in the repair of DNA, and that's another big area. So the jury's out still on how good it is for longevity, but it definitely has some benefits in people. Infusions, I don't see the benefit for that. I know people love it because it makes you feel like I'm doing something, I'm putting a needle, but NAD belongs inside the cell. And NAD itself has to be converted to NMN to be put into the cell. So when you put NAD in the vein, it has to go to the cells. The cells take it, they convert it to NMN, put it in the cell, now they can use it. So you have to reverse engineer. So what I tell people, you want to increase your NAD? Through Niagen, NR, or NMN. There's a few companies out there that do very good quality. Again, in your supplements, always look for good companies. We can help you with that.
Yeah, and we don't sell supplements. We don't try and upsell anything. So for us, there is no benefit. In recommending any supplement.
Exactly. And what I look for, something I would take. Companies that I believe have the right credentials and they're monitored, self-monitor. Now, another thing about NAD that you may not know as a patient, and you have to be careful with every supplement. That's why it's so important to come to a place and get tested and find out. If you have MTHFR, you have a deficiency in the gene. MTHFR is a gene, by the way. It's not a condition. But you have a variant that does not let you methylate appropriately, and you take NAD. Anytime you use NAD, it just gives you more energy. And one of the processes, it uses methyl groups. So you're consuming methyl groups, which are important for people who are deficient in that gene or have a variant that makes them inefficient methylators. You need to be on a vitamin B complex, because if not, you're going to extinguish your methyl groups and you're going to exacerbate any condition related to that MTHFR. So a lot of people, oh, I'm going to do NAD because my neighbor is doing it. Are you a MTHFR deficient, that 30% of people that do not methylate? You're going to harm your body. You're going to get in trouble.
People are going to malls to get these infusions.
That's the scary part. And then if you do it under medical supervision, you have been tested, and we find you are MTHFR deficient, we put in a B complex, methylated B vitamin complex, we give you NAD. Now you're providing the tools so the body can use that NAD efficiently and benefit you on both sides. So this is one of the things I always try to inculcate in patients. Test yourself, find out, monitor. That way when you do something, you're really helping yourself and not doing good here and harming the other side.
Yeah, well, thank you. Thank you so much for sharing so many insights. And I can't wait to do more podcasts together, dive deeper into different topics. We're so fortunate to have you here at Sydenham. Before we end today's podcast, we would really like to know what's your personal biohack trend that you're following these days?
Well, one of the latest ones that I have been doing, my house looks like a freak house because I bought a red light lamp and put it over my bed. And it's when you do this, make sure you buy the right kind, again, certified, that has the right tools. But that's one of the things I'm doing. Is great for the skin. There's proven benefits, and it has a combination of red light and near infrared, which penetrates deeper. So I don't know. I have to see what happens. I just started, less than 2 months ago.
Right.
So we'll see. And finding the time is the hard part. So what I try to do is do it early in the morning. That's one of the biggest things I've changed now, and and I'm trying to do more sauna because it's in my gym and I used to do it. But the more I see the benefits, the more I realize I need to do more. So those are the two things that I, lately have done, and it's. Is
there a trend that you quit, like an anti-trend?
Not really, because I don't jump in trends very quickly. I probably overanalyze them,
right?
And then I go for it. But one thing that I started doing, and I say, well, I don't see the benefit. People were doing taurine, and they claim all these benefits, and the more I read the studies, then I realized not ready yet. Some people claim it's going to be one of the biggest things, bigger than creatine, and that brings another thing. Creatine is another one that I love, and I've been recommending like crazy for its cognitive benefits, muscle benefits, but not to get off topic, the taurine, I would wait before you put it into your repertoire of things to biohack.
Right.
Give it a little time because we need to know more information. There's controversial about maybe too much is bad for the heart, maybe, so I will be careful.
Well, thank you for that. I could go on for hours and hours. Thank you so much for tuning in to Ask Syd, our official podcast. Please ask Syd, all our Sydnam doctors, different questions, and we'll keep bringing them back on our show. Any parting comments from you, Dr. Lugo?
No, thank you, and welcome. Come visit us, come see us. If you're in the Woodlands, we're here all the time. And, I'm accessible through, if you want to email, I have questions. We have a great staff here that will help you answer any questions, and just visit us. Just come see the place and have a chat.
Well, until next time, health is by choice, not by chance. Make better choices, make informed choices. Thank you so much.